Maria Chaudhry. I'm a midwife and an herbalist, and you're watching Apothecary Wisdom. And today we're talking all about fevers. You'll find it in the playlist. We've talked about types of fevers, and then we made another video about what causes fevers, and right now we're talking about how to treat a fever. We're going to talk about them first in general terms, and then we're going to talk about how to treat a fever with hydrotherapy. So, in general terms, how to treat a fever, we know this stuff, you know this stuff, but the first thing is to get plenty of rest. It's really important, though, that either you're the one with the fever or you're taking care of someone, that they're in a room that has good ventilation, but there's no draft. There's no air conditioning vent on them, there's no fan blowing on them, no drafts. Another thing that's important is one of the challenges and problems of a fever is a risk of dehydration. Fortunately, a symptom of a fever is that someone's excessively thirsty because you want them to drink a lot. So you want them to drink fresh, cool, clean, pure water, or you want them to drink some herbal teas, or you want them to drink some juices. And when I say juice, I do not mean high fructose corn syrup juice, a pretend juice. I'm talking about a natural vegetable or fruit juice, and really I would dilute it because it's a lot of sugar. We talk about starving a fever, and I don't literally mean that they don't eat, but they're going to have a loss of appetite, right? They're not going to want to eat very much. So what you're going to give them is minimal food, but the food is going to be really high quality. It's going to be soups, or it's going to be fresh fruits and fresh vegetables. I really suggest minimizing grain, dairy products, sugar, and fatty proteins. Right now it's just really pure, clean. The body can't handle too much right now. It's not going to absorb it or metabolize it. The other thing, a general thing, is about supplements. If you're used to taking like iron supplements or zinc, because zinc is really good for your immune system, your body can't absorb it right now. Rather, if you're going to take supplements while you have a fever, probiotics and vitamin C would be the supplements I recommend. The other thing to do is really letting the fever run its course until it gets to be 102 degrees. In the previous videos, I defined a fever, right? And the grade, the variations would be from 99 degrees to 102 degrees for an adult, or 99 degrees to 103 degrees for a child. And then for an infant it would be 100.4, and at that point you should seek medical care. Also, in this video I want to talk about how to heat up the body, because in the previous video we talked about how the body heats up, and it heats up on purpose because it's trying to kill the pathogens, because those germs can't live in a hot environment. So once the body temperature gets to be about 102 degrees, you want to start to treat the fever. You want to treat it when it gets to about 102 degrees because of that reason, and also because by that time somebody's starting to feel really uncomfortable. Fevers hurt, like they have body aches, backaches, headaches, cramping, they're tight, they're tense, they just can't sleep really well, they're uncomfortable. So those would be reasons to treat the fever. We're going to talk about right now with hydrotherapy. So hydrotherapy, you would benefit watching this video if I had a bunch of illustrations and ways and props to explain. I'm just going to try to be as clear as possible for you. I learned all these techniques in this book called Home Remedies. I really recommend you get this book if you're going to take care of somebody with hydrotherapy, or if you're a massage therapist, or you're a care provider. This is a great book. Okay, so hydrotherapy. You can do hydrotherapy with just water alone, or you can add essential oils to the water, which I don't typically do that. I work with herbs, right? So I'm going to add herbs to my water, and I'll tell you more about that at the end. We're treating this fever, but we're improving this whole body. We're actually trying to, in this hydrotherapy part, we're going to contrast hot and cold temperatures. And we are trying to actually heat the body up just a little bit more, so to inspire perspiration and to help the body heat up just enough to kick the immune system in a little bit more so that the body will take over. So the first one is a hot bath. So you put them, before you get started on any one of these three things I'm about to tell you, you need to be well prepared before you do it. What I mean by that is you need all your sheets, towels, blankets ready. You need the hot water and cool water ready. You need to have their clothes that they're going to get into ready. You need to have their bed prepared and ready. A person with a fever, they can't help you very much. Sometimes they're helpful, a lot of times they're non-compliant, and a lot of times they're weak and they're not able to help you. So you have to be the one in charge. You have to be kind, but you have to stay in control, and you're the one that's taking care of the scene, right? Before you start any one of these, you want to be real clear of what their temperature is. If their temperature is above 102, between 102 and 104, you don't want to do these, right? So if it's less than 102, then this is when you would start to do it. So take their temperature orally, not axillary. It's just do it orally, and with an infant, take the temperature rectally. Okay, so you're clear on their temperature, you're all set up, you're going to start to draw a hot bath. You draw this hot bath, you get them in the bath. If their whole body isn't submerged in the water, get a cloth, a washcloth, and cover up their legs with the hot water and cover up their chest with the hot water. But then you need a cold cloth, a cool cloth for their throat, the back of their neck, and then one for their face, and they need to have cool water. Sit with them, make sure they drink. You want to check their temperature. There's a fine art in the timing of things. They can't take a cool sip of water and then you take their temperature. You have to let their actual temperature be in their mouth and then take their temperature. So get clear on that. Once you get them to between 102 and 104, they should start sweating. You let them sweat, let them sweat. Then you'll start to, once the temperature starts to rise, you don't want it to go past 104. So then you just have to wait and see how long it takes. I usually am not in there very long. 15 minutes, maybe 10 to 15 minutes. I wouldn't go past 20. So they're starting to sweat, they're drinking water, and now when you're time to transition them out, get a cool bucket of cool water, not cold water, cool water, and pour the cool water over them. It's going to be very cold for them. And then you rub them, you friction rub with a kind of a rough washcloth or a friction brush, and friction rub their entire body. They'll be rosy red, right? And then dry them off, completely dry, and then put them to bed and make them drink. Make them drink. That's number one. If you don't have a bathtub and you want to do it differently, you can do a hot foot bath or a steam bath. So you need a chair, you need a big tub, a container to put the water in for their feet, a basin for their feet, hot water, once again, fully prepared with all your things. You're going to set them down. You need a towel under their seat because they're naked. So they're going to be sitting naked, sitting on a chair, a towel under their bottom. You need a sheet that's big enough to wrap around them and the basin on the floor, and then a blanket to wrap around them. So now you have this, you've created this steam tent. Around their neck area, you want to put a cool cloth so that covers the front and the back of their neck, and you need a cool cloth for their face, right? And they need to drink cool water. You really need to keep an eye on them because the steam can be hotter than they think, and they can heat up. Keep their temperature in between 102 and 104. Let them start to sweat. They start to sweat, and they're starting to break the fever. Once again, you're going to finish the same way, but this time you're not in a bathtub, so you're not going to pour water. You're going to get a sponge bath, a cool water sponge bath, and you're going to sponge them off, rub them, friction rub them, dry them completely, get them dressed, put them to bed. The last way to do it is called a fomentation. A fomentation is just a hot, wet compress. And so When I did it in the past in my family, I used a shower curtain, but when I taught the class how to do it, we used trash bags. So you need a big plastic sheet, either a black trash bag or a shower curtain, and you're going to cover your bed. You're going to need your biggest cooking pot, like the one you're going to use to can peaches in, right? This cooking pot, you need to have a large towel that is 2 large towels. So you're going to get hot water in there and these 2 large towels. One large towel is laying down on the plastic mat. Your patient, client, loved one is going to lay down on their back on that hot compress, and then you're going to lay another hot compress on their chest. Then you're going to cover them with the sheet. You could put another plastic over the top to hold the sheet, hold the heat in and keep everybody dry. And then cover them with the sheet and cover them with a blanket. Once again, you have a cool cloth on their neck, cool cloth on their face. They're sipping water through a straw, and you can put hot towels around their feet. Monitor them. Keep their temperature between 102 and 104. Ideally kind of climbing so that they start to sweat. Once things start to sweat and they start to cool off, then cool sponge bath them. You have to have the cool sponge bath that helps relieve the toxins, because they're sweating all these toxins. You don't want to just leave them with the toxins, so you have to sponge them off. And then friction rub them, then dry them, then put them to bed. Those are ways you can manage with water, right? I like to add herbs to my water, and when I do it, I add a cold and flu bath. So cold and flu bath is a blend of herbs that are diaphoretic, and that means they promote perspiration. They're febrifuges, that means they help reduce a fever, and they're nervine, so they're good for pain, and they're decongestants, so they help open up congestion, bronchioles, tight lungs. All of these methods are really good for reducing a fever and opening up passageways, nasal passageways, sinus and lungs. There are a few contraindications that I need you to know about. If your client, loved one, person you're taking care of has a heart condition, you know if they have a heart condition, and you know that you don't know that much about it, then it's too hot. It's too much, it's too hot, it's too wet, it's too much for them. So don't do these methods on a person that has a heart condition. Also, please, ice baths. Ice baths are reserved for temperatures that are like 105. We're not having that conversation. We're talking about a person that has a lower temperature, right? 105, you should already seek medical care. Let them do the ice bath. The other thing is, please don't rub them down with rubbing alcohol. It has a noxious fume. It's not very good. Oh, but another way you can do it is with an apple cider vinegar bath. And I tell you how to do that apple cider vinegar bath in our course, Herbs for Kids. And it's a free course. When you go to our website, Birth Song Botanicals, and under the children's section, you'll see this course, and you can download it for free. There'll be a link in the description. And I describe all about how to create these apple cider vinegar baths to help reduce fever. And I talk a lot more about fever in the book and in the course. So I encourage you to download that and enjoy that and learn from that and take care of your family. Watch the other videos. The next video is going to be about how to treat fevers with herbs. If you're watching this anywhere other than our website, birthsongbotanicals.com, I encourage you to jump over there right now, check out our blogs, download the course, listen to the other podcasts and the other videos about Apothecary Wisdom. And as always, my friends, drink deep and always walk in beauty.